going to be run by Alan Jackson's sidekick, Desley. She's going to do the shared success stories with teams. It's up to you, Desley.
Oh, thank you, Max. Yeah, I wish I was a sidekick. Hey, yeah, I think this session was mainly about hearing from the teams themselves and basically how they're going, especially during this time with COVID. You know, just sharing the stories, learning from each other, sharing ideas and things like that as well too. So each of the teams have 5 minutes each, and yeah, like I said, we're just asking how everyone's going during this COVID time, any of the challenges and how they've overcome them. So I might start off with Sachin at Bega. Sachin, before you begin, who else have you got there in the room with you?
Well, people coming in and going out. So I got myself here and Anna behind me, Andrela and Jack. So Victor has just gone out to get some fruits for tomorrow's session. So let's see you then. First of all, I would like to acknowledge the traditional owners of the land, the Wangata country here, and also all other people from where you all zooming in, and pay my respect to elders past and present. Because of COVID, we haven't got much done in the last 6 months, but we worked from home from March to May. So about 4 months we stayed at home and we couldn't do much. So the main challenge was all the events and visits were cancelled. So team could not contact any community members and schools just stopped us going there, which affected our planned activities and overall statistics. But we took that opportunity to think about what are the innovative ways we can engage community members. So first thing we did was created a TIS Facebook page. If you search on Facebook, Bega TIS, you'll find that page. And it was created in beginning of April. We also created and distributed some care packs. So this was just before we worked from home. We created few packs to distribute to the clients, which had TIS information, as well as hand sanitizer, a soap, and some information about quit smoking, how smoking can affect you if you catch COVID-19. So it had all that information. But later on, when we went home, we were working from home, we created a few more care packs, and which was a joint project within Bega departments. So we created about 100 packs and distributed to people who are at risk, who are elderly or who got young kids at home, who can't really go out or who are at high risk of catching COVID. We also had that opportunity to create some videos and we posted on our Bega's YouTube channel as well as the TIS Facebook page. And one of them, you might see Victor and Andrela there talking about quit smoking. We also did join Bega departments to help clients in needs with their transport, medication, and food. And the TIS team also joined with the street patrol, which is run by local council to assist homeless and rough sleeper clients. So this was an organizational approach towards COVID-19. But after restriction eased, from June 2020, we started going to local communities and nearby schools. So we started contacting local schools and we booked, I think about 3 schools at that time. And we kept working with them. And in July, the team resumed all the outreach activities. So we started going outreach. The response was mixed. some communities didn't allow us to go. Some communities said, yes, you are most welcome. So we could do some outreach visits. The team also attended few minor events where we had less than 50 participants, and it is a good start. So we're looking forward to a few more events happening in this month, next month, and in November. So the night of week is happening in second week of November. We're planning for that, and yeah, so the team is getting very busy now. About the successful event, we thought about World Tobacco Day. In last 6-7 years, we celebrated World Tobacco Day as a major event. We've been out promoting this event for 2 weeks every time, but this time we couldn't go out. So what we did is we set up static displays at Bega Clinic reception as well as Resort Pharmacy. So these were the places who were mostly busy even during the lockdown period. And we saw a lot of people checking out the displays and maybe saved some information about quit smoking. We also promoted post on Bega Facebook page. So we posted on an average, we posted 2 posts every day. So it was a good engagement. And from that report on Facebook, I can see that we posted 15 posts in 10 days, and we reached about 2,500 people. And the total engagement was 232. So as a start, it was a really good engagement. But apart from that, yeah, we are getting really busy, and we are very lucky in WA, especially in Kalgoorlie region, that we had literally no cases. There were 3 or 4 cases, but they all been sent to Perth. So it's kind of normal for us. Yeah, so that's from our side, from Bega.
Oh, thanks, Sachin. It sounds like that you had a bit of a slow start there, but yeah, started to get really busy in the end there. Sorry, did you say that you created a because you started off with the Bega Facebook page, but now you've got a Bega TIS Facebook page? Is that what you said?
Yeah,
Yep.
it is a separate page because the Bega Facebook page is mainly for clinical information, and they want to keep it very formal. While you know how we go anywhere and we keep doing things which are different, which may not be formal, but and also in terms of recording stats or engagement, we thought we should create a separate page where we can keep posting, which I manage that page, and we keep posting on upcoming events or even employments or when we visit schools or places, we usually keep posting on there.
Oh, great. That sounds good. So we should make sure that we friend you on that Facebook page. That'll be good. And your own YouTube channel as well too. That's really good.
Yeah.
Very good. Okay, thanks for that, Sachin. And by all means, if anybody had any questions or anything, just type them up through the chat and just send them through to Sachin and the team there at Bega. Who have we got here from CAMS? Is Jamala there?
No, it's me, Nicholas. Sorry, I've been a bit busy getting pulled here and there, so apologies, everyone.
Nicholas, where are you? Oh, yeah, sorry. I can sort of. You're Benjamin, aren't you? Benjamin Stewart. You're one of the Benjamin Stewarts.
I'm one of the Benjamin Stewarts. So let me see if I can change my name. But my name is Nicholas.
Okay. So how's it going up there in the Kimberleys?
Pilbara for me.
The Pilbara.
Yes, I'm in the oh my gosh, I just came over from Victoria. Started in March of this year, and I've had to go back and forth. So I've been in and out of the quarantine process twice. So I've done a fair share there. Can you hold for 1 second, please? So we have had quite a bit going on out this way with regards to TIS and the TIS program. We've experienced some very interesting stuff with regards to being having access to communities during the biosecurity period. So obviously that meant that the more remote communities meant that we had considerable. Thank you very much for that change. We weren't able to have the access to those communities, and so a lot of our focus was directed up within the immediate catchment, and also working with Ngaanyatjarra to provide services in the Port Hedland space. So all in all, it's been quite an experience. This is my first one of these, so please feel free to direct me on what information you all would like to know a bit about, and I'll go from there.
Yeah, sorry, Nicholas, was there very much challenges around the COVID stuff, I suppose, with the within your team and getting out? Yeah, it must have been really difficult though. But so what kind of activities that you had done? I suppose a lot of the social media stuff too.
Yes. So what we did was we've increased the work that we've done with regards to small, I guess, one-to-one sort of engagement is what we tried to do, and more general stuff. So for example, we would have participation in, like, for example, the Newman outreach. So there was a weekly, I shouldn't say it ran every day of the week, of the work week, where we would basically participate in a community stall in community, and we would actually be working from there. And then from there, we'd be looking to try to engage and increase awareness through the clinics. And that was more telephone support, things like that. Where possible, we looked for ways to engage with and this is really during the COVID period, we looked for ways to engage directly with, I guess we'd like to say with the clinics and with small groups, things like that, where possible. We did obviously do some bits and pieces on Facebook, and we started to look at focusing our efforts on television and working on enhancing our promotions through that way. We also did some stuff where we actually found quite useful is where we would go into, and I'm calling them kind of like drop-in sort of promotion, where we would go to where people were naturally congregating, because what we were finding is that those that stayed in town, we saw some people stay, but we saw a considerable amount of people return back to country, so they actually left. And then with the biosecurity, we weren't able to have the access. So we were looking at where we could go, where people were camped and things like that, and have some, again, small group sort of interactions in that way, which was actually really successful. Providing lots of like promotional bags and things like that, where we can encourage people to keep having the conversation. But we also acknowledged that it was a bit stressful for everyone because they were having to suddenly be uprooted from what they were doing before to now being told don't have this social distancing and all this other stuff. And so it was a difficult time for some people during that period. So, and the smoking was one of the bits where people were often using it to just kind I guess maintain a certain level of calmness and things. So it was a challenging time, obviously, for us with social media, with COVID. But again, social media where possible, and bouncing off of things that were happening already in the communities where we can kind of piggyback on. So we weren't trying to duplicate, or we weren't looking to create efforts or duplicate efforts. We're just trying to be smart with our efforts there and position ourselves for once we came out of COVID. Sorry, I think Tesla, you're muted.
Nicholas, who else is in your team there?
So
you're in Pam's.
Yes.
Yep.
So we've got a subcontract with Ngaanyatjarra, where we have 2 staff there, and then there's also Jody, who has been working with Pam's for as a TIS officer here for the last 18 months, and then I'm just kind of joined on, and I'm trying to get my head around everything and learn.
Okay. Cool. Very good.
So,
very good.
So, like I said, I apologize for not having a polished bit to say. It's been quite a learning experience, and like I said, there's been quite a bit of work that's been done through that period. And like I said, it's been a bit of a learning time for us as well.
Well, let us know if you need any assistance with any of that as well too, of course. Max is on hand any time of the day and night.
Thank you so much.
That's all right. Thanks for that, Nicholas. So, Geraldton Aboriginal Medical Service, that's you, Kurt.
Yes.
So how you've been going there?
Yeah, we've had a few changes in the organisation. Vicky has left, so she's no longer with us as a TIS coordinator. And so we currently looking for a new TIS coordinator to join up. Yes.
I thought you was the TIS coordinator.
I was acting TIS coordinator for 3 months, and then so we had a lady come in, Carol Martin.
Oh yeah.
Used to be for run for Parliament Kimberley. Yep. Right. So she come in, and now she's helped out a bit, and now we've advertising internal. Yeah, the organisation.
Yeah. Okay.
Yeah. So that was one of the changes. We've had a few programs happening because the WA board is a bit relaxed with the COVID stuff happening. So like as soon as it happened after it, we had like a family fun day, the annual one, in March. So just along after that, that's when all the COVID stuff pretty much happened, and we went into like sort of helping the clinic. So all of our resources were sort of aimed at helping out at the clinic and stuff. So. But amid all that, we came up with a few new programs that we have developed. Like there's like the Deadly Dirt Quiz. So that's around when you go remote, we created like a remote control car game. It's around smoke related questions and stuff. Yeah. And also we created a drum beat program. So we use like djembe drums, the African drums. So we utilise that in smoking education as well. So yeah, that's another one. Also, we have a men's fishing and yarning program that we've started up, so that we get some of the elders and go out fishing and try and get some of the younger blokes to quit as well. We do like a PCYC Thursday night safe program. So they sort of feed the local kids and keep them away from the town. A bit of trouble downtown, so we attend that every Thursday and provide the food, for the young kids, and also provide smoking education there. The drum beats have gone mad with all the schools, so we've got 22 schools in a district, so we're trying to flat out 5 TIS members try to service all those with the drum beats.
Yeah.
And we've also come up with a few new posters, like around vaping. So like vaping is vicious, not delicious. That's one of the catchphrases. Also, Brent from our team has created an NRT product flip chart for like a A3 and A4 size, and A5. So that's for correct use of NRT products. Yeah, so we've developed one of those for our own. And yeah, we also have like some of the organisations in town look for us to come to the local businesses and do the drumbeat thing as well. So all the programs and stuff we got, we can email all the info to all the guys, everyone out there. Yeah, so that's about it.
You'll have to send some photos of the drum beat.
Yeah, we'll send some photos of the activities and where people engage in it, and yeah, the public, and yeah, some of their posters and stuff.
Yeah, and the what is the Deadly Dirt quiz?
Yeah, the remote control car game.
Oh, that sounds good.
Yeah,
yeah, that's great. So, any of these resources or anything like that, we can, if you want to put them on the Tis Yarning Group Facebook page and then share them with others. That's I've never heard of that before. The Deadly Dirt.
Yeah,
quiz.
No worries. Yeah, we can share all that stuff. As well.
Yeah, that sounds good. Thanks for that, Kurt.
No worries.
You haven't had any cases there, hey?
We've had like a couple, but the same as like with Bega and Kalgoorlie, just a couple of mild cases, and they sort of just get sent to Perth.
Yeah. Okay. Yeah. Oh, that's good. Very good.
Desley, it's Tom. Can I ask some questions, please?
Sure. Yes.
Of Kurt. Kurt, you know, both the fishing and the car one, the remote cars.
Yeah, mate.
How do you monitor who's smoking and who's not smoking on there, and how do you report on or know whether you got any successes? Like
we sort of do like surveys with the kids, and we just, if with that outcome, we just ask them general questions about if they learn anything from the day, and just provide like smoke-free homes stickers and stuff like that. With the other one, the men's fishing and yarning, we try to have them do like a 6-week program where we like work with them and then see if we can get them on the NRT products and do like combined therapy, to try and help them quit.
So how many smokers versus non-smokers go on your fishing activities?
We were doing like trying to get non-smokers. We had like we try to get smokers. Sorry, we get some to come up, but then they'll like only come for like a couple of sessions and not come back. Yeah, so sort of we're still trying to get some more numbers there. Sort of, yeah. And
so, do you let them smoke when they're on the trip?
No smoke at all.
So yeah.
We tell them.
And if you work with the with grams, you know, they can administer patches whilst they're there during the day, and maybe have a grams officer, health worker go out there and just monitor how the patches are working with them, and use that for dialogue. Because I think, you know, that's a sort of very active type program if you do it like that, versus just have an activity which we can be criticised on. That is, you know, it's recreation. That's not what we're on about. So we've got to link it back to smoking, giving up smoking, maybe testing it with patches and so forth.
No worries.
Thanks, mate.
Thanks for that, Tom, and thanks for that, Kurt. No, that's great. Mawarnkarra, Maria. Is Maria there? Or anyone else from Mawarnkarra? Hey, look out. Okay. Oh, there you are, Benjamin Stewart. Sorry, I just saw your hand. Yes, you're waving. Hello. Can you unmute?
Sorry.
There you go.
Technical difficulties there. Can everyone hear me?
Yep.
All right, cool. All right, so on our end, following all the COVID stuff, we've had a pretty good opportunity to kind of review some of the stuff that we have been doing. And so yeah, we're based up in Roebourne. So yeah, essentially kind of following on from all the COVID stuff, we were able to kind of look at all of the things that were on offer around town, mainly in sort of Roebourne as well as Karratha, Wickham, and then Samson and some of our other surrounding sort of jurisdictional areas. And we've noticed that there is a lot of repetition and sort of duplication in services. So we're moving towards a lot more sort of collaboration, which is actually having a lot more I guess, traction within the community, because we're building on relationships that already kind of exist and are working. And that way we're actually being able to get into some of those sort of priority groups. So, you know, the young people and slowly getting into people, sort of that middle adult range that we find quite tricky to capture here. In that collaboration, we're also able to go into different areas that are a little bit more external to this space. So places like Onslow, we'll be able to kind of tap into those areas. And at the moment, we're trying to look at ways of actually having a presence there that isn't necessarily based on us physically being there. So looking at sort of those training and upskilling opportunities, maybe some mentor sort of roles, or those sort of community leadership roles. So working with other organisations to kind of look at what that is. But so when COVID restrictions were lifted up here and sort of easing sort of around the end of June, we had an event at one of sort of the main, I'm trying to think of the right way to describe it. Yeah, one of the main cultural centres, and that was about. It basically came from. We identified that there was a need within the community around some education about smoking. Obviously, smoking is sort of chewing tobacco, especially in the older age demographics and within the elders. So the team here basically went into those spaces, took photos of the oldies kind of using tobacco in certain ways. So really looking at the chewing tobacco, so the formation of that plug that they use to chew. And so yeah, the slides contained images of people, or you know, the hands, I should say, of people that were in that are local to this area. And then the content that was actually made from that was both in English and in Nalama, so in language here. So we, the Janelle, one of the other workers here. So we've got four team members here. If you can't see any of them, so yeah, we made two presentations sort of for that evening, both, as I said, in English and in Nalama. And that made it a lot more relevant to the people that we were targeting. So we had a whole group of oldies up and a whole group of families and kids. So the turnout was really, really good, considering how close we were to sort of the end of the restrictions. And the comments and the feedback from that was, you know, we had a lot of the you know, the images that you get on cigarette packaging. So the cancers, the gangrene, sort of diabetes, and sort of the visuals of the feet, but the descriptions of those and the explanation of those were in language. So a lot of people actually got a lot more out of it to actually understand that this picture is related to tobacco usage, essentially. So that was really successful on our end. Yeah, I'm trying to think of some other bits and pieces. Any questions? Sorry, I just spoke out everyone then.
That's okay.
Yeah. My question is, if those plain packaging diagrams in language, if you could send us some copies of that, that'd be really useful, because we work with Mainstream Tobacco who create those, and they'd find it very interesting, particularly if they're having an impact, and as you said, able to commence a dialogue with the community, which is really important.
Yeah, totally. Yeah, we'll send that through.
Maria, who's there with you? Is it
me? Sorry. So my name's Jerry. We've got Sandra, and we've got Penny.
Hey.
And then we've got Janelle.
Hey. Oh, lovely. Too deadly.
We're on a new team as well.
Oh, good. Oh, sounds like you're doing some great work there. Oh, very good. Hey, where are we going now? To Wheatbelt. Hey, Jody. No, Zoe. Zoe.
Everyone, so Zoe here, and I'm with Connie, so we're out in Merredin, and then Alyssa is also out in Northam. She's pretending to be Zoe today as well. So firstly, I'd like to, there we go, there's Alyssa. So we're meeting out on Ngaanyatjarra land, so I would like to acknowledge the Ngaanyatjarra people, the Noongar Nation, and pay my respects to elders past, present and emerging. So I suppose we out in the Wheatbelt continued working from our offices the entire time during the COVID period. I suppose a few things that we were working on was one, streamlining some of the processes and templates we had in place. So we've developed a new monthly reporting tool that aligns to our action planning, all our planning tools and things like that were updated. And then we also looked at completing all our planning and reporting and all that for the next 12 months and the previous 6 months. So one of the things we've developed is a 12-month communication strategy. So the way that works is that the comm strategy, there'll be 2 months for each campaign, and it's aligned to the Noongar seasons. So bringing that cultural component into our messaging. So we've currently just finished our Bajari Yoga campaign. So our campaign targeted at pregnant women and has included things like creating some posters, social media, content, our Bajari Yoga billboard campaign that went across the Wheatbelt. Also, we plan to run events during that, but unfortunately haven't been able to get back out in community just yet. And then finally also kind of developing some social marketing strategies as well. So that's something that we'll be rolling out, and we'll be targeting young people, men's health, chronic illness, numbery-free or smoke-free environments and spaces, and then also vapes and e-cigarettes across the next 12 months. And each campaign has 3 key messages we're delivering. And I suppose during the COVID time, then we were also really looking at our social marketing and strategies that we could do, because we had to really rethink. We couldn't be out in the community delivering our programs. So although we finished our Kadadrin Numri, which is our tobacco knowledge education program, so the team's developed a 5-week program, and it's targeted at each of our priority groups, so we can deliver it for Bajari Yogas, so pregnant women, men, chronic illness, or young people in schools and in community. And basically we've got that all ready to go, but we couldn't go out and deliver it. So what we did is we picked that up, and it's kind of got that cultural component as well as our animated clips we've created, hands-on activities, and then also clear learning objectives and deliverables as well. So what we've done with that is we started doing upskilling in-house and through VC, so practicing our presentations skills and getting kind of familiar with it all, and then delivering that with our staff in-house and then also within the teams, so they're aware of what the key messages are as well for our health workers, nurses and so forth. And with our social marketing campaign, so we ran that during COVID, so we had a young people campaign, so the Drop That Smoke video, we've had it edited to become suitable for a 30-second clip. That ran out on TV, NITV, GWN. We also ran it on social media, TV, GP waiting rooms and so forth. And then we also looked at numbery-free spaces. So we couldn't be out in community, but we had signage. So we developed culturally appropriate signage to complement our WA Country Health Service smoke-free policy. So we've updated the signage at 5 different health services that we work with, and looking at expanding that more. And then also wrapped one of our cars in numbery-free messaging and our branding as well. So that was pretty cool. And then during the COVID time too, we actually picked up and used our health promotion skills to complement the response to the pandemic. So being with WA Country Health Service, obviously leaders in creating content, and there's a lot of content coming from Perth. Our challenge was that we didn't feel, the feedback from the community was that it wasn't really culturally appropriate. People were kind of getting mixed messages and not really aware of what they were really meant to be doing. So we took that up and we kind of facilitated addressing that. So a few things that the TIS team did was using those health promotion skills. So we developed our WAS communication team, so our Wheatbelt Aboriginal Health Comms team. we met each week on VCs and identified any gaps and opportunities, and then started creating resources. So we created a comms strategy plan about how we're going to address that, and then looked at tailoring our messages. So social media, posters, we made stop sign stickers that were removable, put on people's doors, hand sanitizer, and lots of little clips on social media and videos and things. So we did a mail out to 2,500 people using social media. Definitely our elders clips and things reached about 10,000 people, and just trying to really change the way we were working a bit during that time. I think that's
our signage reach.
Yeah, so during that time though, we have been able to collect data on our signage. So in our 5 health services that we have put our signage up, it's reached about 28,000 people. And so just kind of keeping that reach and those messaging going. So even though we weren't working directly with community, and I think the greatest challenge working with WA Country Health has been we have quite lengthy approval processes, and that has been a real challenge. So any poster, flyer, anything we created has about 7 tiers of approval before it can go out, and that does take quite a while to get the messaging out there for anything and everything we do, but we stick with it.
7 tiers, wow. That's good that you've stuck it out for that long. Hey, TWN, is that TV? Is that radio?
GWN, yeah, so like our Channel 7 regional.
Right. Okay, and they give you data on all of that.
So I have asked that question to Max as well. We again, with government, we have to go through a separate media buying agency, and we can't talk directly to media. So it was about an 8-month process to actually get that up on TV.
Right.
But I did want to ask, and I'm not sure when or if we can do out a session, but how to report on the reach of things that such as a TV commercial or social media where it potentially might come out of our, we targeted Great Southern, but obviously that crosses over outside of the Wheatbelt region, so how we would report on that.
Yeah, no, that's a really good question. We've actually, at the moment, we're doing some performance reporting workshops. We've had a couple over the last, since Monday, and we're doing one more tomorrow as well too. And so it's all about, how are you writing up your reports, and, specific questions like that can be really helpful for not only for your team, but for others as well too. So it's good to have, we'll actually, before we finish today, I'll get the times and everything, or Ben might be able to put them up around when those times are. But we've actually got 2 workshops tomorrow at different times. So you can pick and choose which one to attend. But when it comes to completing the performance report template, that's a good time for the sessions. There you go, Ben. Very good. 10 a.m. Adelaide time and 11:30 Adelaide time too. So there's the link there. Okay. And of course, don't. You can also call us a little bit later anyway, Max or I as well too. Oh, thanks for that, Zoe. We missed out Cams, Jarlin. Are you there? Where are you? I can't see. Oh, there you are. How are you? How are you going?
So we'll just go straight into it.
Sure.
So, I'm Jamila, and I probably have met everyone before because this is my first teleconference with you guys. So thank you. And I guess we just start with acknowledging the country that we are working on, which is the Yarra land, to leaders past and present and emerging leaders. So thanks for having us on today. So yeah, I guess COVID's sort of the word of for the last 6 months, and I guess trying to come up with creative ways to keep the TIS program moving forward. So we did go on to develop a Facebook page as well, and like we've heard previously with Sachin's presentation, we've kept us separate the CAM's Facebook, because we didn't want any confusion, particularly around COVID and then COVID and smoking, and we wanted just to keep it separate. Also, other creative ways of sort of reaching the community, particularly with the TIS guys on the ground throughout the Kimberley. They've all went ahead and developed their own web pages, social media, Instagram, but also, you know, putting together packs also, particularly they, like some of the places, one in particular, Kununurra, they developed home packs, particularly for kids, because, you know, they were stuck at home with school being out, having but less social interaction, I guess, as well. So there were other, you can jump in anytime. Sorry, I put my glasses on. So we also looked at, I guess, the strengths around with the social media. So instead of focusing on smoking, we went into a lot of activities, and I think a lot of people went in to do, you know, home activities and home challenges around fitness. So we teamed up with a lot of other organisations around that, and did hashtag Stay Connected, and also the Solid Fit, and which is a separate program. But so there were challenges on Facebook around keeping fit and looking at those strengths sort of stuff. A lot of people, what we found is that, you know, kind of don't want to put themselves out there on Facebook all the time and taking pictures about themselves. So a lot of people, we resorted to a lot of photos of just what's going on in the Kimberley, families getting together, sitting under a starry night, getting photos of bush food, you know, and just staying strong as a family unit. So we sort of resorted to that sort of style of, you know, the positive around, you know, around smoking, being a healthy family. Along the way, we've been developing a few new TV ads. One in particular that we probably would like to try and share. Yeah. Is that possible? Can we share? We're going to try this out. I don't know, we might lose you guys, but we'll try this. I don't know. No. Yeah.
How's it going?
Okay. Yeah, we're just trying to try and share this TV ad that we've just been in the middle of making at the moment. Well, completed, but we just have to put it on air on GWN. And so we focus it around small kids, and it's a bunch of Kimberley kids and what they thought about smoking. And it's just a black backdrop. So the whole focus is on the child, talking about what they view as smoking. So it starts off very light because the age group was from 5 to 10. So with the younger kids, you know, it starts off, you know, quite funny and what they thought about smoking. And then it goes to the, you know, slightly older kids where they sort of got some more serious messages around smoking and what's associated with smoking, you know, and the common ones is, you know, the kids are saying, you know, it's not good, you get cancer, you get very sick. A lot of editing done with that because a lot of kids are very, very honest, you know, and they talk about, oh, my grandmother smokes and auntie smokes, and so we had to cut a lot of that sort of stuff out, which is fine. Mm-hmm. But there's about 3 different ads that's about to go to air at the moment with GWN. Other things that we're developing is like a Monopoly game that Geraldton's been working at the moment. Anything else, Geraldton, that I might have missed? No. So since the communities have opened up just only last week, we hopefully can get some more traction about going into remote communities and getting some more messages and activities going on. And the schools have been great. So we've been involved with the Clontarf boys, and also, I just lost my train of thought. There was something else. No, it's gone. Yeah, and that's about it. I think it's just moving forward. Unfortunately, I won't be in the position for much longer. I'm sort of shifting away as well. So Geraldton's going to be around though. So hopefully there'll be a new TIS coordinator soon. Just thought I'd just give you the heads up now.
Okay, very good. And so, but your area, you look after Ord Valley.
Yes, so we look after the whole Kimberley region. So that's
And
Ord Valley and Kununurra,
yep.
Wirrangi in Horse Creek,
Yes.
Derby Medical Service, and Broome here at Brahms.
Yeah, very good. So we'll keep an eye out for that TV ad. Just interesting to know. Well, yeah, what is that region? Then that would cover all of that, the area there, and
Yeah, it's a big area to cover, but I think, you know, with the COVID hitting, you know, we went into major shutdown, I think like everywhere else, but there was a lot of emphasis on, given that we've got, you know, Kimberley and Pilbara got majority of the Indigenous population. So we very strongly focus on the remote communities around COVID. So we've pushed a lot of resources around the COVID, around that.
yeah. Oh, it sounds like you're doing some really good work there too, especially for those younger ones in the communities. Okay, we might go to Perth. Samuel, I think. Samuel is at ACWA, the Aboriginal Health Council. Hi,
Yeah.
Samuel. Who's there with you in the room?
Hey, yeah, I'm Samuel. We've got Dawn, Zach, Trisha, and Amanda. So yeah, we're here in Perth at Aboriginal Health Service WA. Just before I start, I'll give you a little update on what we've been doing. I just want to acknowledge the traditional owners and custodians of the land where we work, the Whadjuk people of the Noongar Nation, and pay our respects to elders, past, present, and future. Yeah,
Samuel, sorry. We're just sounding a little bit soft there, like you're whispering.
Is that better now?
Yeah, that's getting better. Yep.
So yeah, I'll start just before COVID. Yeah, in January, through my connections, I was able to.
Nah, sorry, Samuel. Gammon, you stand up there, yell real loud.
Yeah, I'll come close now. Look.
Gotta be simple. Oh.
Is that better? Where's the one? I think it's the problem.
Well, I'm putting my ear close to that thing too. Well, how?
Is the volume turned up?
Yeah, we just looked at our microphone volume.
Unmute now. See, yeah, it sort of goes up, then it goes really low. Start off good, but then it goes softer.
What is the number?
Cam and everyone put their ear to that thing there.
What if I sit here? If I sit here, is it right? No?
Maybe, yeah, when I'm right, maybe we'll work on it. And then...
You're going to go to next update and we'll be on the next.
Okay.
You're
All
good
right.
now.
Oh, yeah, go on. Keep going, Samuel.
All right, I'll go.
Yeah, that's good.
So yeah, in January through my connections interstate, I was able to attend Friends Camp in New South Wales, Tweed Heads, which is for Aboriginal and Torres Strait Islander youth from all over Australia. So yeah, that was a good event. I was able to attend and hold a few educational sessions for the youth there. I got pretty good feedback from that, as well as our organisation for me attending that. And then in February, our team were able to, we went to the Graham Polly Farmer Foundation Youth Conference, which was held at the West Coast Eagles base here in Perth. So yeah, our team were there again running activities and providing information and education for students, high school students. Yeah, then moving into working from home. Through COVID, we worked on updating all our PowerPoints and creating sessions for when we get back from COVID, going back into the school community, and yeah, providing those information. So that was good. We got to update all our systems that way. And then we also had to look at, like everyone else, doing things online through Facebook, social media, TV ads and radio ads and things like that. So we ran quite a few competitions, trying to get messaging out there to the community. And yeah, so that was very good. We prepared giveaways for those events and the competitions. You might have, if you see our Facebook page, Tomorrow's Dream, you'll see the competitions we've had on there. And yeah, so that was a good thing to come out of, learning to do that, and yeah, get messaging out to the community that way. We also worked on like COVID Facebook messaging, around smoking, like trying to not to share smokes with your family members through this time, and being hygienic and things like that. What else have we got? Well, we also created a few apps for your phone, so games. We created, as a team, the TIS crossword. So if you've got a, I think it's on places like Android. It's on Android at the moment. So if you've got Android phone, Samsung or something like that, you can download, go have a look, download that TIS crossword. And then we've also got 4 picks 1 word as well on the Android. And then yeah, just that we were able to work on our virtual reality games. And also we're creating another game at the moment called NRT Man. So it's like Pac-Man, but yeah, NRT Man. So that should be out soon, hopefully. I think that's about it, is it? Oh, and we've just finished our TIS campaign around secondhand smoke in cars. So we've just finished an advert, which will be coming out in cinema, TV, and radio. And also on the back of a bus, so a bus back. So they're good ways to get messaging out there for the mob all out to see. Hopefully you guys will see some of it floating around as well. So yeah, that's about it, I think. Yep.
Very busy, true. Wow. These fellas better slow down a bit, eh? No, Gammon. Hey, Tom, no. Yeah, no, it sounds really good. Just making sure that, with all of this stuff, all of these activities, what does Sir Arthur Conan Doyle say? Data, data, data. I can't make bricks without clay. Yeah. So, and of course, the impact that we're having on our communities out there too. And we should see all of that in our reports that are coming up shortly. Okay. Oh, thanks for that, Aqua team.
Nice.
Oh, very good. And we'll have to have a look at those, the crossword and the apps and everything else that you've got going there. Really good. Oh, lucky last, Janice. How are you feeling there, Janice? All right? You got to unmute. There you go.
Yeah, can you hear me okay now? No.
Yep.
That's better?
Yep, all good.
Oh, great.
Very good.
Yep, fantastic. Hello to everyone. And from our team, there's just Georgia and I here. Georgia and I have been working for about a year, almost a year, the both of us in our program. We, of course, we acknowledge traditional owners and elders and our beautiful young people who are emerging as our leaders. Like everyone, we too, we've got the similar target groups. And with every activity that we do with our target groups, we write up an evaluation, and that's for everything. And it goes onto our intranet. And we ask the person who has presented the activity questions like, well, how do you know what you did was successful? And sometimes it might be through a question answer technique. It might be something like, do you think COVID-19 will get out here into the desert? Which is always a very interesting one. With everything we do, we've basically taken a three-pronged approach, and in a nutshell, that would be through education, employment, and training. They're the three things that encompass everything that we do. It's been highly successful because of two reasons. We have sought out Aboriginal leadership in our community, and we've got some amazing people here. It really is an untapped resource. And they were absolutely fabulous in contributing to the COVID-19 response that we did. And I can tell you more about that anyway. But we sought out Aboriginal leadership. But I think the other thing that worked and continues to work well for us is that we start off with a strength-based approach. We don't start off with levels of disadvantage, and we know all those things are true, but we engage with our mob. And that was another critical feature for us, not only in terms of our, if you like, normal TIS stuff, but also the COVID-19 stuff. And what Georgia and I did since we started work here, we engaged with our mob. We went out, stood outside stores and roadhouses, got chased by dogs, but we were able to engage with our mob, which was the main thing. And what that meant was when the big COVID stuff, took a hold, because we had already done that really important relationship building with our people, I think it would be fair to say that we had already developed trust in our relationships. And I think because of that, people were more inclined to want to work with us. When I said those three prongs, education, that wasn't necessarily from a Western perspective. We engaged with our elders, and a lot of the work we did was in language. We plastered all the advertising and social media tools available to us, and just about all of our information was done in language, not in English. Then we just kind of took off running then, and Georgia did a lot of work with that social media. We got televisions up in all of our clinics. We've got all the community people all talking in language, so that when somebody goes to the clinic for whatever, while they're sitting there waiting, they can see their own local mob giving out strong messages related to smoking as well as to TIS. And that was a really very highly successful venture, and Georgia was the one responsible for all of that. Do you want to say anything more about that and what you did, the social media stuff?
Yeah, as Janice said, basically we got a lot of our elders and people who are quite respected in this community to sort of create small video clips that were sort of quite visual, so sort of talking about lots of different things, and then we kind of combined a bit of COVID and tears because that was all the talk at the time and where our managers wanted us to go with it as well. So we sort of made a combination of things and then got that distributed throughout the lands on all of the televisions that we have in the clinics. Because we couldn't engage with the community like in group kind of things, that was the way that we saw was the best way forward.
Yeah, we utilise our environment a lot, and so we will often, you know, take the women and the men out separately, out bush, and it's really interesting because our mob, like if they're chasing a goanna halfway to Laverton, they don't actually see that as they don't see it as exercise. And I'm thinking to myself, oh my God, I'm going to have to jump in the troopy to try to keep up with this lady. But it's just really interesting. They just see it as something they've always done and something where you get a good feed. So that's good. And we do bush medicine, and we do a lot of stuff that comes from a very, very strong cultural base.
Oh, that sounds really good, Janice.
It informs just about everything we do.
Yeah, and that's the best kind of basis that you can have, eh? Yeah, for sure. Oh, that sounds really, really interesting, and sounds like you've got those activities that, you know, that are localised down pat there. No, that's great. Thanks for that, Janice and George.
So with all our target groups.
Yeah.
And, you know, like, and the other thing too, you know, like in the last couple of months, we've had a funeral just about every week. And so we're looking forward to things like NAIDOC coming up, when we can just do some really, really fun things just to lift people's spirits.
Yep. Yeah. Oh, that sounds good. Very good. Hey, thank you everyone for that session. And of course, you know, again, the TIS Yunning group page, Facebook page is there for everyone to share their stories. And, you know, you guys are pretty good. Western Australia's always been that really well-connected team in the whole state. So stay connected by, you know, asking each other how yous are going and everything like that. If you are going over each other's regions, always make sure that you have that conversation with each other. You know, so if you're finding that, especially with those TV ads or anything like that, if they're going over to another TIS team's region, what can they do to help with the data or with the stats as well too? So, you know, it's all, again, it's that partnership there, but it's also partnership with each other and working as a whole state in Western Australia, and getting that data out to everyone. Oh, sorry, collecting that data there. I might hand back to you now, Max, and thank you again, everyone, for that.
Thank you.
Any questions?